Hello, guys, and welcome back to the Diabetic Desk. Like I said, November it's Diabetes Awareness Month, so each Friday I'll try my best to have these sessions uploaded on my Vimeo. So I'll leave the link in the article that I normally post every Friday or across my social media platform, especially Facebook. So do like my page, go subscribe, just stay tuned to the diabetic desk. We're going to learn a lot about diabetes. And today I want us to talk about why diabetes awareness matters, because I feel like we should know why awareness is important when it comes to diabetes. So over the next 20 minutes or so, I'll try my best. I'll walk you through the scale of the problem, why awareness prevents harm, and exactly what we can do as a community and healthcare professionals. Um, in general, like I said, diabetes desk is not just for professionals alone. It's a space where everyone who wants to know about diabetes can come in. So if you want to collaborate with me, I'm open. I leave the number at the end of the session so that you can reach out, email me, let's collaborate. So we're going to look at the scale of the problem. Of course, I always start with numbers. Numbers really matter because data shows us exactly what we are facing. And I feel like diabetes is no longer a rare disease. Globally, recently, an estimate of around 1 in 9 adults, that is about 11.1%, are living with diabetes. And those are the people that we are aware of. Yes? The largest or the latest diabetes atlas shows a rapid increase in many countries. Yes, especially in the low income countries. And the analysis suggests that when wider testing is used, the number of adults with diabetes may be much higher than the picture I have painted here on these slides for you guys. So to just put it in a simple language so that we can be able to understand is millions of people worldwide are affected and many do not know it. So that is from the International Diabetes Federation. That is where I get all my diabetes information. So I hope the numbers are painting the real issue. This 11.1 globally might just be the ones that we are aware of. But there's a large portion that do not know they have diabetes, and I know you're here watching me, you've never tested your sugars, you don't even know where it is. And you know, type 2 diabetes, which largely affects adults, accounts for over 90% of all cases. So you might be there as an adult walking and you're not even aware you have diabetes. So it's quite alarming. So we're going to look at why awareness matters and delayed diagnosis and the effects, because many people live with diabetes for years and years without even knowing. When diagnosis is delayed, the disease quietly damages the eyes, the kidneys, the nerves, and the heart. Those are the long term complications. Sorry. And that is why awareness is not just about facts. That's why I've started with the facts, but we're going to dive more into that. It's about getting people tested early so that we can start treatment and support before irreversible harm occurs. So community awareness increases screening uptake and shortens the time between the disease onset and the care. For me, I 100% believe pre-diabetes, I've not said diabetes, I've said pre-diabetes can be reversed if it's caught earlier on. That's why we champion for early screening, community awareness, to just reduce stigma and help you guys find time to go and get tested. That's why Diabetes Desk is here to create that awareness. So we're going to look at the human and the health cost. Of course, I have to look at the numbers in terms of the amount of money that goes into management, and diabetes complications, which includes blindness, kidney failure, leg amputation, and heart disease. They cause disability. I was looking for a good word to put it that way. And when that occurs, most of the time it reduces the work capacity And you've noticed type 2 diabetes is starting to creep into the youthful economic powerhouse. So you'll find someone who is in their mid 35, they're just starting to work, they're starting to earn economic empowerment, and then they are told they have diabetes, or most of the time they have kidney failure, or they have hypertension, which most of the time reduces the quality of life if it's not well managed. They'll find the heavy burdens or the care goes to the family, and in many settings, complications are the leading cause of long term disabilities among working adults. So, awareness therefore prevents suffering and preserves livelihood, because if you're able to know about diabetes, to know if you're at risk or not, if you have diabetes or not, there'll be early diagnosis, which you can start caring or managing it earlier on, so that you can prevent those said complications, so that your life can continue as it is and you can maintain your quality of life. Because for me, I still believe, I know I've written it in bold, awareness and early intervention really saved lives and resources. So we're going to look at the treatment gap. Yes, we do face a treatment gap. A large number of people with diabetes or living with diabetes do not receive regular care. Reasons include limited access to medicine, especially if it's not in a public setting where the insulin is standardized, or what is it called? Hiyo word unilemea kusema. Like they've standardized the cost so that people can be able to afford high cost, low health literacy. And literacy, I mean, in terms of education. Awareness campaign can also help close the gap by encouraging testing, informing people about where and how to access care, and advocating to many, um, and also make essential medicine or medication affordable. If you're not there, you'll not understand what I mean by, you can be counting your test strips, or you can be counting your medication, na unaangalia kwa mfuko iko kavu, and you have to maintain or regularize your blood sugar level. So I feel like awareness drives advocacy, and advocacy drives policy. That's why I'm here to make noise for you guys, so that we can be able to champion. So if you are a healthcare professional, this November, try your best, even if it's in the hospital, even if it's on social media platform, to create awareness around diabetes and let people know about early signs, screening, testing, and all that. I feel like educated communities demand and sustain better health system. Yes, I hope you've understood that. So prevention is possible, yes. Most type 2 diabetes is linked to modifiable risk factors. If you've been listening to me, I usually talk about modifiable and unmodifiable. So modifiable factors are those factors that we can change, that is poor diet, low physical activity, overweight, and smoking. Evidence shows that lifestyle intervention can reduce progression from prediabetes to diabetes. So when awareness leads to lifestyle support and structural changes, in communities, for example, better access to healthy food and safe places to exercise, will reduce future disease. So I'd leave you with prevention saves billion in the long term healthcare costs. I feel like when people are aware, you don't underestimate the power of education, the power of health literacy. If someone knows, they're able to do better. And I'm so glad these days people are woke, people are taking good care of their health, they're sorting out certified nutritionists to just help them walk that journey, and that I can give it to you guys. Yes, so we're going to look at screening and early detection. Screening is a vital key. For me, I'll always advocate for screening. Community based screening, when well designed and linked to care, find people who will otherwise be missed. That's why I advocate for medical camps. I don't know, maybe I can find partners so that we can have the diabetic camp. I don't know. Let me see. I have ideas when I record for you guys. Let's see how it goes. Common tests usually include fasting, blood glucose, random blood glucose, HbA1c, or oral glucose test. I gave you guys what these tests are, so I don't feel like I want to repeat it. And also, we're going to look at screening program must have a clear referral plan. When you identify someone without a path to care can cause harm, because if someone comes in and they exhibit higher HbA1c and then they go home without proper referral plan, I feel like it cause more harm, because a higher HbA1c means in 3 months the sugars have not been controlled. Yes. So awareness events should always be paired with referral or immediate primary care support. That's why most hospitals do medical camps, and then when they find something, they send you to the hospital for further screening, further tests, so that proper plan can be put in place. I advocate for adequate follow up. Screening and follow up are very, very important. So if you're here and you're planning campaign awareness campaigns this month, please have a proper referral plan in place, so that we can capture those people who might not actually go to the hospital. And it's quite shocking, you guys. Ukiambia mtu twende upime, nipime kwa nini na mimi niko sawa, you know. You people shock me sometimes, anyways. So, we're going to look at before we dive deep, I forgot to mention the high risk groups, and those are those who are overweight. Overweight is those with the BMI of 25 and above. But for me, BMI, I want you to partner it up with your body composition. Go to I think most nutrition clinics have that equipment, so that they can tell you your body composition in terms of fat percentage and the kind of fats you're supposed to be aware of. Family history and age, those are non-modifiable risk factors. When it comes to family and age, especially those above 40, you really have to be cautious. You have to really start taking good care of yourself. Go for those screening. I know mnaogopa, ukipatana na watu wazee unawaambia uende hospitali, it's like you're sending them to anyways. So we're going to look at the special groups. Gestational diabetes affects mothers and babies and increases long-term risk. So screening during pregnancy is essential. That's why we advocate for antenatal clinic, antenatal visit. Go for all the 5 or 6 of them. Mi hata naambianga watu, ukijua you're pregnant, go uanzie proper, so that you can be given those supplements. You can be checked to see if you're okay, because I know most pregnancies, especially there are some that are oops. So you have to really be careful. Go for the screening and visit, especially the 24th 26th week. That is when gestational diabetes inaanzanga kuonekana. So children and adolescents need attention too, because they have type 1 diabetes, which require immediate insulin access, and adolescent obesity increases future risk for type 2, and these days childhood obesity. So awareness program in maternal clinic and school have a higher impact. That's why I always love people who do research. I tune into our department, what is it called, department presentation, and I always feel happy when I see people doing research on school going children, school program, school feeding program, because I feel like that's where the major impact is felt. Yes. So we're going to look at social determinant and stigma. These days unaweza dhani stigma haiko, guys, but stigma is there. And I feel like social factors really matter. Poverty, food, insecurity, unlimited education, rise diabetic risk or diabetes risk, and make care harder to access. Stigma and blame are common barriers. Guys, stigma is present. Unajifanya like huku nje, oh, tumeacha stigma, but stigma is there. People fear judgment and may hide symptoms, kwa sababu unaogopa ukiambia mtu, unajua mi nakunywa maji mingi sana, naenda choo sana, I'm always hungry, and I feel dizzy sometimes when I don't eat. Like wanaogopa kusema. So awareness campaigns that avoid blame and promote supportive messages encourage people to come forward and seek care. That's why I wanted this platform, the Diabetic Desk, to be a free space. Kuja usome, whether you're a healthcare professional or someone who wants to just know about diabetes, kuja hapa, go watch at the previous pre-recorded webinars or sessions. I have talked a lot about diabetes, and I'm going to talk more this month. Kuja, come forward, seek care. Ukiona like unaogopa, DM me. I will send you to the right places, so that you can get tested and all that. So it's very, very important to shift the narrative from blame to empowerment. And I feel like peer groups and support networks really improve management, because mkipatana watu wenye mna go through the same thing, it really helps to deal and also work Yeah, and then cultural sensitive messages, I feel like improve acceptance. That's why most projects fail, because if you don't look at their culture na wewe unaenda unaanza kuambia hizo vitu, you really have a hard time, na community ikikukataa imekataa, well, those people. So going to look at the hair economic hair system impact. Yes, so let's look at the health costs and the health impact of diabetes. And I feel like I said, especially if it affects people who are economic in the economic era, I feel like it reduces productivity, especially in the low middle income countries. The effect is worse because late presentation means more complications, and then investing in awareness, prevention, and early treatment is not only humane, it's cost effective for society and employers. And I feel like, why is this slide important? The theme for this year is diabetes and well-being, and they're focusing on workplaces. So we're going to dive deep into that because, like I said, it's starting to affect people who are working. So you have to have a proper working environment that also helps prevent and early detection. If you can call in, we are here nutritionists. There are some corporate nutritionists. Call them in, let them talk about these things so that your employers or your employees will know, and offer them what is it called, offer them a chance to go and get checked to see if they're okay or not. Remember, there's work related stress, and stress is one of the modifiable risk factors, and it's very very dangerous because siku hizi tunanyamazia tu vitu, so it's very very important for you as an employer to look into that. I don't dwell more on this because I'll have a session purely to talk about diabetes and workplaces, so be on the lookout. So what makes awareness campaign work? Yeah, use local language. That's why I'm trying to mix Kiswahili hapa. So kama uelewi Kiswahili, pole. And culturally relevant messaging. Combine mass media and community outreach and clinical services. That's why I want this diabetic desk to grow, so that I can partner up with like-minded individuals who are also keen with diabetes, so that we can do more. We can champion for patients and their stories to break stigma, and importantly measure results. How many were screened, how many were linked to care, evidence show multi prolonged approaches with good referral links are the best. So if you come to the diabetic desk unaniambia, but then I feel it, and then I refer you to an hospital or a place where you feel safe, where you can be checked and further tests can be done, and then management can be put in place, I feel like the impact would be good. And for me, I do adequate follow up. So I'll follow up and make sure everything is okay. And I feel like that is what makes awareness campaign. Culture. Siku hizi watu wako kwa social media, utilize that. Yeah, so yes, so we're going to look at the Kenyan context. Of course, we're in the low middle income countries, and in Kenya, as I was doing my research, urban Kenya show higher diabetic rates than rural areas, and 1,000 of people remain undiagnosed. Like watu wengine hawajui, like wakiona medical camp wanazunguka the other way round. Barriers include cost, availability of medicines, and low routine screening. Kwanza ukipata mtu mwenye ameambiwa kuna diabetes, you will have a hard time because hajakubali, anakataa, and then it makes delayed treatment measures to be put in place before akubali. 4 months zimeenda, high sugars, complications zinaanza kujionyesha. So I feel like local campaign targeting marketplaces, workplaces, and antenatal clinic can catch the people most at risk. So I wish, wacha tu to grow, guys. I believe we will grow. We go to marketplaces, campaign, workplaces, antenatal clinic, and all those, because hizo ndio high risk places nimeongelea kwa this session. So we're going to look at my role as Charity, the diabetic desk. I feel like I'm educating. If you've been following me way before I started this webinar on LinkedIn, every Friday I post about diabetes, and every Monday I try to do case studies and we dive into nutrition and diabetes management. Empower, I'm trying to equip you guys with practical lifestyle changes to the best way I understand. Connect, this is what I'm working on. I feel like next year, because it's November, December na early next year majaliwa, mashallah, let me say that I am going to see if I can start partnering up with organizations so that we can do something about diabetes, because masters imenipeleka mbio, but I'm almost done, guys, so it gives me room to focus on this. Advocate, I am using digital storytelling, so mkuje hapa msome. Go to LinkedIn, go to my Facebook page, or any of my social media platforms. I really educate on diabetes. And then I feel like these sessions are a thought leader. They're helping you guys. Mmejua diabetes ni nini, and I'm really championing for it. So kujeni, follow, subscribe, ni support. We see what we can do. So just as I finish this session, najua nimesema sitaongea sana, but guys, you know I lie. We learn and share symptoms and risk factors, organize screening days and link to healthcare. That's why most hospitals are usually there, and then wanakulink up to their hospitals. I feel like we should also promote stigma-free, actionable messages. That's why for me here, you'll never see me judging or doing anything. And then this theme is diabetes and wellness, especially in the workplace. We're going to look at diabetes in the workplace, schools, and clinics, especially the antenatal aspect, and then track results. Those people who are in the immediate, immediate contact with the client, please track results. How many people have you screened? How many people have you referred? And how many have you linked? And if you've linked, what like follow tu mpaka huko mwisho, the nutrition care process. Follow mpaka mwisho and make sure the person is well taken care of so that you can reduce complication. Guys, that's just it. This slide ya mwisho ni references. If you want to read more, you're curious like me, please do. So this has been your session. I know I've been passionate. Kama uelewi Kiswahili pole, but I want us to be on the same page. So tune in next Friday. I think I will talk about diabetes and workplace, because I feel like we're almost at World Diabetes Day, which is on 14th of November. So stay tuned. And I've been yours, Charity, the founder of the Diabetic Desk. See each other next time. Bye.